Dear colleagues in the Japanese Federation of Social Workers, it is a great pleasure to be with you today. I've been asked to prepare this pre-recorded video lecture on the technical and ethical challenges that social workers experienced across the world, and then later we will have the opportunity to meet via video link for further joint reflection and discussion. With this pre-recorded lecture, I have to ask for your forgiveness in advance. I will be reading the text that I have prepared. This will enable the translators to more quickly and accurately provide translations, but of course it will also mean that it will be more difficult for me to relay the passion of social workers' actions and also to use their quotes directly, as this is always challenging in a long lecture that will be translated. I will, however, do my best. Before proceeding with the lecture, I want to express my gratitude to the Japanese Federation of Social Workers. There are two key reasons why. The first is that the Japanese Federation has for many years supported regional and global learning, especially on the social work role in disaster situations. The body of skills that was developed and shared through this work has been immensely useful for social workers globally, meeting the challenges of COVID-19. We will talk about these skills a little later in this presentation. And secondly, because the Japanese Federation is organising this event. The pandemic is far from over, and we can expect more pandemics in the future. Therefore, this is not a post-reflection, but an opportunity to continue learning and building our skills for tomorrow and for the future. Events like this are essential, not just for us as social workers, but even more importantly, for the societies we work within and the future generations. So thank you so much to the Japanese Federation of Social Workers. The arrival of COVID-19 pandemic in early 2020 prompted an unprecedented global effort by social workers to reorientate services to meet the needs of both existing clients and the millions of people whose lives had suddenly been thrown into turmoil by the virus. This effort, in circumstances that might at first have seemed impossible for a profession that prides itself on having personal contact and relationship building at its core. However, what happened was a remarkable transformation of social work. The pandemic effectively caused a shift that set a new course for the profession. The rise of COVID-19 prompted social workers to be creative, to think of new ways of making their services and values effective. It sparked a culture of transformation in social services, which in turn helped transform lives under the most difficult of circumstances. In many cases, the old structures could no longer function, and this gave social workers a form of liberation. They got back to the roots of social work, going out into the communities and supporting them to help themselves. A wonderful analogy was made during the IFSW conference in July 2020, as social workers reflected on what had happened during the past 6 months. The old structures increasingly pushed social work into a crisis management role, picking up the pieces after the damage was done, or as we say in English, picking up the pieces at the bottom of the cliff. The IFSW conference, however, affirmed that social work needed to be at the top of the cliff, heading off disasters before they happen. In many countries, this was to be achieved during the COVID crisis by working through and with communities. The pandemic revived this kind of community-based social work. This lecture, based on the book To the Top of the Cliff, charts the continuing transformation of social work from the first outbreaks of COVID-19 in China in January 2020 to the new global strategy for the profession agreed at the IFSW conference in July. A set of priorities which made clear a new sense of purpose developing in social work as a result of COVID-19. Let's start, however, at the beginning of the COVID crisis to understand how social work reacted. The Wuhan lockdown began on the 23rd of January 2020 after the World Health Organization said there was evidence of human-to-human transmission of a new coronavirus in China. That day was chaos, Shen Lanlan, then director of the Wuhan Wifi Social Work Service Centre, said to me. She was one of the leaders of the social work response in Wuhan, in China, when the real threat of the virus first became apparent. The first thing she did was to gather an online group of colleagues using the WeChat app at that time it was the best way to organise people quickly. They had to respond to vulnerable residents. Many were in isolation or suspected of being infected with the virus. In less than 3 hours, the WeChat group was set to full capacity. We felt helpless and overwhelmed, said Chen Lanlan. Everywhere there was panic and anxiety about what lay ahead. Many residents worried about being infected and didn't know what to do. In those first hours, we knew that the demand for social work and social support services had multiplied many times, so we had to empower ourselves, she told IFSW. By the second day, the social workers in Wuhan had established order. They had decided to divide each day into 2-hour shifts, with an allocation of 183 staff, teaming social workers, psychological consultants, medical volunteers, and support staff. By the early morning of January 26th, Chen Lanlan had been working continuously for 96 hours with her partners. These were the first actions of the social work response to COVID, which marked a pace and level of responsibility that social workers took worldwide. The challenge was huge. Chen Lanlan and her colleagues had to simultaneously help existing clients and expand services to meet new needs that grew by the minute. To get around the lockdown restrictions, they had to accomplish this in completely new ways, based around telephone and online networks rather than face-to-face contacts. They operated more than 20 online service groups, servicing more than 10,000 residents in support of need. Children, teenagers, elderly people, women, people with disabilities, providing advice and support by online live video streaming services. Together, they managed 200,000 online contacts. Throughout it all, teams contributed to some remarkable work offline too. Some social workers spent day upon day queuing at hospitals to get medicines for patients with severe disease or who had no other way of getting their treatments. Other social workers spent many weeks with children in an isolation hotel where their families had all become infected with the virus. Social workers stayed with and assessed and supported many vulnerable people who needed to be quarantined in hotels. They also distributed vegetables and COVID-19 prevention packages, masks, disinfectant, alcohol wipes, etc., and financial support to the many families dragged into the economic trouble by the pandemic. More than 2,000 social workers in Wuhan, as well as many medical and psychological volunteers, were involved and helped around 300,000 people. Word went around about the innovative work of Wuhan social workers across China. As the disease spread, the Chinese government used much of what the social workers had done as a model for the rest of the country. In turn, they influenced the shape of social work services around the world as the pandemic progressed and the International Federation of Social Workers publicised their work. Social workers in every province are actively involved, wrote the Chinese Association of Social Workers in a report to IFSW in February. We believe everyone's efforts are the greatest support for prevention and to contain the spread of the epidemic, they said. But the work took its toll. Chen Lanlan told us, over more than 2 months of lockdown, I found it very hard to sleep and much of my hair fell out. Most social workers experience fear and anxiety, she said. Over 70 days of the Wuhan lockdown, some social workers didn't have a single day off. Then they became engaged in high-intensity work of community reconstruction, which continues to this day. And as a result, we have seen social services have changed. Change in the delivery of social services normally takes years. There are exceptions where political direction coincides with the aspirations of communities and social services workforce, but these are rare. What happened in the first 6 months of 2020 was something entirely new. A pandemic was the prompt for social workers in nearly every country to be at the forefront advocating for and leading change. In February and March, IFSW was receiving dozens of calls a day as the pandemic moved from one country to another. Social workers across the world were facing constant challenges in the face of inadequate resources and collapsing health and welfare systems. Working through and meeting such dilemmas has been a strong characteristic of global social work response. Through the reports being sent to IFSW, we maintained an overview of how social workers in different countries were finding answers and at the same time encouraging learning across national boundaries. In each country, there was understandable fear and uncertainty at first. But this was rapidly followed by action and innovation, characterised in 4 phases of social work action. 1. Making governments recognise that a social response is imperative. 2. Advocating for social services to remain open during lockdown. 3. Adapting social services to a new world. And 4. Social transformation as social workers found innovative solutions with social work values at their core. From the earliest phases of the outbreak, social workers knew they would have to lobby hard to make governments recognise that a social response was needed alongside a medical one. They had learnt this from previous experiences around the world with Ebola, HIV and SARS, as well as other epidemics and pandemics. Their task was informed by early reports sent to IFSW by the Chinese Association of Social Workers about their actions before the virus had spread outside of China. The Chinese Association called for personal protection of social workers and developed guidelines on how the profession could support communities through the crisis and prevent the virus from spreading. Chinese social workers also set up hotlines for vulnerable populations and where possible worked door to door in communities, ensuring that people were safe and supported. Globally, in February 2020, IFSW made the painful decision to cancel all of its public events and conferences, even though the majority of countries had not yet locked down or were even acknowledging the coming pandemic. But ending face-to-face gatherings and moving to online interaction was essential and reflected social work's strategy of adapting quickly to challenges. Everything possible had to be done to prevent social workers getting the virus and inadvertently carrying it back to the communities they worked within. The Social Work Day poster, which had been depicted a handshake, was changed to 2 people at a distance bowing to each other. As the virus spread beyond China, lockdowns were implemented in many countries during March. A number of governments initially responded by considering social services as non-essential, believing only a medical response was needed. Social workers pushed back. Korea was one of the first countries to adapt the Chinese model of lockdown, and correspondents from the Korean Association of Social Workers on the 6th of March reported that social workers who have been helping vulnerable people have become infected, resulting in a service vacuum. Community welfare centres are all closed, so vulnerable people are not eligible for services. Social workers in Romania were among those to challenge the government's closure of social services. The Social Work Association successfully lobbied ministers to overturn the decision. In the following days and weeks, social workers in many countries won similar battles to keep social services open until governments learnt from each other and it became the norm. Because of these struggles, social work and social services became a recognised part of many frontline essential services. By the 11th of March, the virus had spread to 87 countries and infected over 100,000 people, and the World Health Organization declared COVID-19 a pandemic. As the global scale of the crisis became apparent, so social work entered another phase, adapting social services. Following the template provided earlier by the Chinese Association of Social workers in countries with internet and reliable phone services set up hotlines and WhatsApp groups, Zoom and Skype, and had contacts with families and communities, developing specialised services to investigate and intervene on reports of family violence and abuse. It was a period of significant upskilling for both the workers and the communities. In some countries, the results were extremely positive. New Zealand social workers reported, "Our established clients are able to contact us by phone in moments of tension or when they have questions, and are able to reflect on the issues far more deeply than we had experienced in more formal settings, or when we visit their homes or at an appointment time." Yet there were challenges, especially relating to first contacts. Social workers following up on reports of domestic violence said they found it impossible to know whether they were speaking to the person of concern in private. Was there someone else in the room listening beyond the scope of the Skype picture? With victims of violence and abuse, social workers had sometimes to convince their employers to rent motel rooms for survivors to self-isolate for 2 weeks before they could join others in supported residential environments. In countries with limited internet and state social services, social workers used community networks to maximise safety. In South Africa, they worked with community leaders to reinforce messages about physical distancing and minimise fear and blame, for example, against cultural minorities. In Sierra Leone, social workers reminded communities that they already knew what to do under the circumstances. They had, after all, lived through Ebola. They knew about distancing and improving hygiene. George Mansarai, the president of the National Association of Social Workers from Sierra Leone, told me social workers knew that there would be an economic hardship and communities would be isolated. So they would need to build new local capacity. We reminded them, he said, that they needed to start to manufacture their own soap, as they had done under Ebola. Back in South Korea and Romania, social workers introduced systems where workers would live in with vulnerable populations in centres rather than risk carrying the virus in and out through daily visits. This practice quickly spread to other Asian and European countries. This, of course, was an immense sacrifice for the workers involved. They left their distressed families and prioritised the care of society. In many countries, social workers were trying to help populations that were more likely to die of starvation under lockdown than of the virus itself. In Sierra Leone, rural communities ate their own seed banks. In Brazil, entire communities were unable to get fresh water. In such situations, social workers sought exemption from the lockdown to arrange for distribution of food, water, and other essentials. They also facilitated community solidarity, supporting people to share resources and to produce their own life-saving essentials. Often throughout all of this, neither social workers nor the communities they served were equipped with masks and gloves. In Italy, Spain, and other countries, this problem was partly resolved by social workers suggesting that families and communities make masks themselves and ensure that everyone coming into contact with them was masked. Things were moving fast. An update from South Korea on the 22nd of March illustrated how quickly services had responded from a starting point of the welfare system collapse. Social workers were checking on clients with phone calls, delivering meals, and offering face-to-face counselling to the most vulnerable. The Korean Association of Social Workers was also coordinating support for social workers suffering from COVID-19 and the psychological effects of working under pressure and often in isolation. By April, IFSW was receiving several reports a day from countries newly affected with COVID-19, with social workers sharing challenges, worries, solutions and support. In Nepal, social workers were providing social psychological counselling for clients by telephone. In Nigeria, they were conducting door-to-door visits to assess child welfare. In Zambia, they compiled a new database of social work volunteers. In Indonesia, they published new guidance on psychosocial interventions. IFSW and its regional structures set up regular webinars exploring ways forward, in the process reflecting on the core values and the mission of the profession as it advanced its role. A new phase, one of social transformation, was beginning. On a practical level, social workers around the world were innovating at an unprecedented rate, setting up new systems, supporting homeless people to access shelter, starting helplines to address signs of increased domestic violence, providing online family counselling, ensuring that community leaders understood social hygiene, and countless other initiatives. But creating these achievements was not easy or straightforward. Given that both governments and social services were not prepared for a pandemic, significant ethical dilemmas emerged as social work practice unfurled. During the early months, IFSW received dozens of calls from social workers simply wanting guidance in a world where occupational norms and certainties no longer applied. One caller from Italy told us, "An elderly woman has died of COVID-19. Her body is stacked with many others in a church awaiting burial, but her family aren't aware of this, and the family will want to know where her remains are. If I tell the family, they will break the curfew to reclaim the body. What should I do?" the social worker said. It was one of the many dilemmas faced by Italian social workers as their country faced the first surge of COVID-19 in Europe. And social workers across the world have faced similar and constant ethical challenges in the face of inadequate resources and collapsing health and welfare systems. In Australia, for example, social workers were threatened with dismissal for engaging ex-drug users to help homeless addicts into accommodation, even though their strategy proved highly effective. In other countries with resources thin on the ground, social workers are being forced into situations where they had to choose between vulnerable groups, knowing that there would be deaths in whichever group they neglected. Some dilemmas were recounted in webinars organised by IFSW Africa region as the pandemic began to spread throughout that continent. Lack of communication infrastructure meant that in-person contact with clients had to continue. This put social work safety at risk, especially since PPE was in short supply. Calls to citizens to wash and sanitise their hands are irrelevant in poor communities with no access to water, let alone financial resources to produce soap and sanitisers. In many communities, a family of 10 could be living in 2 rooms, so physical distancing was impossible in such circumstances. Was it possible for social workers to stay safe? From the early stage, IFSW was able to document such problematic and sometimes impossible situations, maintaining an overview of how social workers in different countries were finding answers. Its information networks and regular articles, videos and updates encouraged learning across national boundaries. It offered ethical support in each region, and professional associations did the same in many countries. On the 7th of April, IFSW provided new ethical advice on personal safety. Social workers needed to be guided by considerations on how to keep all people as safe as possible. It was not only themselves and their clients being placed at risk through contact. In the event that employing organisations insisted that social workers saw clients in person, they should look to social workers' ethical principles, which say that they should bring to the attention of their employers and policymakers, politicians and the public situations in which policies and resources are inadequate or in which policies and practices are oppressive, unfair or harmful. It was clear that the ethical dilemmas social workers were experiencing ranged far beyond issues of personal contact and risk. Social workers throughout the world had taken swift action and played a significant role in reducing the effects of the virus. But there had been a high price to pay as workers made difficult decisions with minimal resources and without practice guideline policies. It was critically important that research was quickly undertaken to highlight the reality of social work practice in crisis. So in April, IFSW developed a partnership with international ethics researchers led by Professor Sarah Banks from Durham University in the United Kingdom to properly investigate issues and create guidance for frontline social workers. In May, social workers from around the world responded to the researchers' request for accounts of some of the ethical challenges they were facing during the COVID-19 pandemic. In all, 607 social workers from 54 countries responded to the online survey. This not only provided a picture of what was happening, but an idea of the emotional impact on social workers and the creative strategies they were using to address ethical problems. From the challenges of maintaining privacy and doing fair assessments online, to advocating for migrants in transit without food or sanitation, social workers testified how they had taken risks to benefit their clients. You can read of their actions on the IFSW website. From the analysis of the survey, IFSW issued a set of recommendations for social workers, employers of social workers, national associations and governments. They were that social workers need to rethink how to apply professional values and principles in new contexts, engage in ethical deliberation with colleagues, be aware of the impact of exhaustion and emotion on their capacity to see the full ethical implications of situations, and to treat people with respect, empathy and compassion. Raise with employers, professional associations and policymakers the serious harms and inequalities experienced by people during the pandemic, the difficulties in delivering social work and proposals for improvements. That social work employers should ensure all social workers and students on placement are supported through regular supervision and team meetings. develop guidelines with frontline workers about how to operate safely and ethically, monitor levels of stress amongst staff and ensure adequate rest and recuperation, provide necessary hygiene equipment and safety measures, advocate to governments and draw attention to gaps in welfare systems and the need for improvements. That national and international associations of social work have key roles in highlighting systemic factors putting populations at risk and the vital role of social safety nets, intensifying the efforts to collect evidence on conditions for social workers and service users, advocating strongly with employers and governments to recognise social work roles and provide better guidance for maintaining services, continuing to develop ethical guidance for social workers and employers and spaces for peer support and learning about ethical dilemmas in practice. That governments need to recognise the critical role played by social workers in providing supporting social and community-based care during a pandemic. Acknowledge social workers as key workers. Ensure provision of the necessary hygiene and protective resources. Issue clear guidelines on how to maintain social work services during a pandemic, keeping services open while operating effectively and safely as possible. Perhaps it is worthwhile for all of us as social workers to bear in mind a larger picture of ethical awakening that occurred during the pandemic. We found out new ways to apply our ethical principles when tested in the most unexpected of circumstances. But social work during the pandemic has also shown the world new models for responding to need and moving forward in an ethical way. Social workers worked beyond the crisis, assisting people who are experiencing health, well-being and economic vulnerability to translate their fears and concerns into social challenge. In contrast, many governments acted to control the spread of the virus at the national level, failing to build global political solidarity or support struggling communities. As the pandemic evolves and then ends, there is a real risk that we will return to the status quo, a gap between rich and poor, a reliance on philanthropy and charity rather than recognising the assets within the global community which are the foundations of change. For many years, the social work profession has advanced a learning model that collaborates across national borders. Now is a crucial time for the world to establish new global ethical foundations centred around solidarity, equality, and recognising everyone's diverse strengths, rights, and responsibilities. But on a larger level, something more profound was happening. Social workers were again proclaiming their role as advocates and facilitators for a more socially just world. The crisis was an opportunity not just for social work to reinvent itself, but for societies to reinvent themselves too. This was reflected in IFSW's call for action in mid-April, when it called on governments and the United Nations to develop new ethical global frameworks based on equality that would stop viruses born in the context of poverty and climate change. Meanwhile, national associations called on their governments to fund and support the expansion and development of social services. Over the course of the weeks between January and April 2020, the global profession of social work found its feet and kept them firmly planted in the profession's values. The phases of these early months, through desperate worry for people who use social services and the struggle for recognition, adaptation ethical evaluation, and transformative practice demonstrated a profession that has risen to meet the challenge. Next would come a reorganisation of services to fit a new sense of purpose. When lockdown was imposed in northern Italy, travel became impossible for older people in remote villages. They were starved of money, food, medicine and support. Social workers in the area which took the brunt of Europe's first wave of COVID-19 stepped in to create networks of local people to provide supplies and prevent isolation. Community members were postal workers and police officers. They joined networks delivering food and medicines, collecting pensions and providing people with a new sense of belonging. Previously fragmented services for older people rapidly changed to a community-based approach. Social workers are trying to maintain and build on this new foundation of community-wide care. An Italian social worker told me that community work had almost been abandoned before the pandemic struck. But the importance of working with neighbourhoods has become clear again, he said. Now we have to work to improve these networks and relationships. A social worker from Milan said, faced with an unexpected crisis, social workers overcame it creatively using basic skills and materials which were already available, but which had not been previously considered. Indeed, many social workers reported that the pandemic forced them to stop and think how their services could best be organised, and then act on that quickly. The result has been a rapid return to traditional social work principles. Regular, sometimes remote, contact with clients, accessibility to clients through technology, an emphasis on early initiatives to prevent problems from escalating, and a focus on community action. These examples stretch from pole to pole. In Sierra Leone, social workers reminded communities they needed to prepare for isolation and economic hardship that infectious diseases bring. So social workers supported the communities in beginning to manufacture soap as they had done before under Ebola. These examples show how social workers around the world are reclaiming their community development heritage and demonstrating that this is the best approach, not only to address immediate consequences of the pandemic, but also to face the long-term challenges it brings. Taken together, these efforts amount to an important change of direction that may have global significance that extends way beyond the profession itself. Community-wide interventions were once the hallmark of social work profession globally. From the 1980s onwards, as the concept of the welfare state was increasingly challenged, government policies in many countries drove social services towards a short-term focus on individuals and case management, as opposed to supporting relationships within families and communities. This meant that in some countries, social workers' roots in community development became almost forgotten. That trend has now been called into question and is beginning to be reversed. The re-examination prompted by COVID-19 is now revealing a clearer way forward for social work. And as we look towards a future shaped in part by the pandemic, many of us in the profession globally, IFSW, national professional bodies, social service managers, individual social workers, can champion change in a way that social services are delivered. We can use the experiences of COVID-19 to work towards policy engagement with communities, active community responses that support the well-being of all, and social services that are platforms for communities to thrive and avert catastrophes, not agencies just picking up the pieces. The clearest confirmation of this approach came at the 2020 online IFSW General Meeting and the 2020 World Social Work Conference. These were events that, simply by the virtue of taking place online as they did, exemplified our new world. From a pre-pandemic culture of face-to-face meetings, which created cost and travel barriers for many, IFSW successfully moved to an online ways of working, far more consistent with our professional value of inclusiveness. The World Conference had significantly higher registrations than previous occasions, including the Foundation Conference for the International Profession in Paris in 1928, which had 5,000 people. More importantly, the 20,000 social workers, care experience people, UN representatives, and progressive government ministers who came together at the event collectively developed a global response. 5 integrated themes were advanced for social work over the next 10 years. The themes effectively promote the transformation of social protection systems from underdeveloped entities that respond to people in crisis to systems that prevent social crisis and recognise the equal rights of all people. These are the 5 themes creating a long-term agenda for social work globally. Valuing social work as an essential service. Co-building inclusive social transformation. Ubuntu, I am because we are. Transforming social protection systems. And promoting diversity and the power of joint social action. This framework of themes, informed not just from COVID, but from IFSW 90 plus years of global social work experience, highlight the need for social protection systems to be transformed entirely at both policy and practice ends. Over the next 10 years, the international profession will be pushing for state and NGO social protection to be developed with people rather than for people. We want social protection systems to be designed on principles of inclusivity, joint participation, recognising individual strengths, and co-building thriving societies of interconnected communities with shared sustainable futures. The social work profession will have many challenges in advancing this transformational strategy. But if the pandemic has proved anything, it is that the profession is an essential social service, and governments in all countries are learning this. Also, as the new social work agenda makes clear, within or outside of a crisis, social services must be transformed from agencies that pick up the pieces after the damage is done to powerful resources for building community strength and resilience. So this brings my lecture to an end, and I look forward to engaging with you in the live session as we reflect more and hear more about the Japanese situation. Thank you so much, and I'll see you then.